First, I want to thank you for taking your time to join me and talk to me about this and to, let's say, explain some people about this stuff that we know. And well, I actually don't have experience in it because my main focus here would be cancer and patients with cancer because you're the one who's working with them. You certainly know some stuff I don't. And I was not a long time ago, somebody asked me about how what I do or what we do can be used with tumors and cancer. So I prepared some questions, and I know you do a lot of stuff. I know you work as a doctor of Chinese medicine, as acupuncturist, and you know a bunch of other stuff. You're FasterEFT level 3 practitioner, I guess. Yeah, and got lots of experiences in EFT and matrix reimprinting, right? But my focus here would be really kind of about faster EFT, if it's possible for you. And so let's get to my questions, okay?
Cool.
So, what do you think? Is it possible to create a healing and complete recovery with stuff and treatments, yeah, like faster EFT and Chinese medicine or something like that?
Well, that's a really interesting question, and it lies here in with every individual who's receiving care from a complementary practitioner and or an integrative practitioner, where they're taking and looking at more of a mind-body connection in relationship to what's going on. I wouldn't say that a person can have a complete recovery and cure from simply using these techniques outside of using a multitude of techniques and looking at a whole combination of different things. And certainly tapping and EFT and faster EFT have a huge part to play in being able to achieve that for a person. I think it's a fantastic place to start. Because we know, Thomas, that the leading cause of all illness is 85% of all illnesses are due to our stress and our emotions, the things that we're carrying, our hurts, our traumas, that stuff that we'd rather have not have had happen to us in the past. And we carry it around with us 24/7, 7 days a week. And obviously knowing where to start with some of these clients, I'll just give you a little bit of my background. So I'm very fortunate. I work as a part of a complementary team of therapists at a local hospice here in Auckland, New Zealand. We're very unique in our positioning here with the work that we do for patients, where most people that I might share conversation with, when I mention the word hospice, we kind of have this picture or idea that it's a place that we might spend our last few weeks of life at. Or where a family member who's experiencing a serious illness may go for some respite so the family can have a break. Oftentimes people may be sent to hospice at end stage of serious illness. So the nature of the work that we're involved in is that we're more of a day stay hospice. We do have some beds where those folks can come in and have respite care, 24-hour care. But primarily where I am in the facility is in a day stay environment. And we're seeing people at the beginning of their journey in relationship to their diagnosis that they've received through proper medical attention. So there are people like you and I, Thomas, that are coming in, and I'm seeing people from, a multitude of ages, from young folk through to senior citizens, all living and experiencing serious illness. And the diagnosis may have relatively been recent. So some of these people can survive for a long period of time with conventional treatment and care. So I'm a part of a team. We have an aromatherapist. He's also an NLP practitioner and wonderful imagery teacher and meditation teacher, as well as Reiki therapists, Japanese hands-on healing arts, reflexologists, people that take care of skin and nails, because we know when we're experiencing chemotherapy and radiation therapy that these patients are going through experience a lot of symptomology externally with skin and nails, so we have somebody taking care of that. We have clinical psychotherapists, a team of clinical psychotherapists and a medical doctor, as well as a really great team of support personnel through clinical management. So I feel very honored to be a part of this team. It's been fantastic. And certainly tapping is a huge part of my approach now, even though I'm there as an acupuncturist. But tapping is being more and more accepted. So I think it's not fair for me to say that, yes, I believe that EFT and tapping, FasterEFT, so on and so forth, can bring about a complete recovery, but I really think it's a really fantastic place for a person to start their journey and to understand what it is that is going on and to become more in touch with themselves individually. And then there can be a flow-on effect of a multitude of things to do that I recommend patients might want to look at, including relaxing through meditation and practicing yoga and breathing techniques and mindfulness. And good nutrition obviously is so important, because these people are very toxic. They're coming in very acidic, and we know that cancer can't, it thrives in an acidic environment, so we want to get these people, alkalized. But that's a huge field in itself, not my area of speciality, to rejuvenate these folks, to help them rejuvenate by bringing them out of that sympathetic nervous system response of fight or flight and putting them into a parasympathetic nervous system relax, repair and rebuild strategy is very useful in helping them to get good rest, as well as appropriate exercise, and then reinforcing the system through a whole array of things, whether it be FasterEFT, acupuncture, herbal medicine, nutraceuticals, again, nutrition, color therapy, aromatherapy. All of these different therapies are all complementary and integrative. So I think if we look at the whole picture, fundamentally, I know that tapping is a wonderful place to start. Simply because right there in that moment when that person's coming in, it can help to bring them some peace with what's going on inside of themselves. And that's empowering just in its own right, if we can help that person to calm the nausea down, or some of the symptomology or the side effects that they may be experiencing whilst they're having conventional treatments, pulling them out of that stress response and helping them to relax. And tapping is wonderful for that. It's just cooling off those brain centers. And so it's certainly a huge part of what I do. But then, I think it's a collective effort too within my workplace. It's not just about what I do. But for those folks that begin that journey, I do believe and open that door to that opportunity. And even if to begin with it's only a crack that opens, but a crack that opens allows us room to be able to enter into, the possibilities of exploring what there is out there. And the more these people find and look at, and there's so much available on YouTube in relationship to tapping, and many wonderful great tappers. We all have our own areas of expertise, and I just seem to have fallen into this and have explored some of the tapping techniques that I use to be able to, help move the person away from what they don't want toward what they do want, which is obviously, in FasterEFT terms, our aim, release, and transform, art of change. What do you want? What don't you want? What do you want? Going into that toolbox and just helping those people to get to that place. It's really cool.
And okay, well, when the people really go through traditional and medicinal treatment. They get their radiotherapy and chemo. Well, they obviously do have some not very comforting side effects, right? What can or well can we use what we do or what you do with acupuncture and stuff like that? Can we actually like lower the side effects or do some stuff about it?
Yeah, absolutely. And Thomas, that's in part, that's a big chunk of my work. Because I'm kind of at the cold face of that, where I'm experiencing and seeing patients who are, having chemotherapy treatments weekly or bi-weekly, and they're coming in and they're experiencing side effects. And absolutely, tapping is wonderful to be able to work through these things with people. And what's really amazing is I've encountered quite a lot of people, and of course, within our medical system, patients get the information. They're given the information, and obviously we know how powerful words are unconsciously and how we can just take them in. And the way in which some of this is delivered, certainly in relationship to that experience and that moment, that memory, there's a belief that goes along with that. And we want to look for this belief that goes along with that. Because these people get told that they're going to experience side effects, and they get told what they're going to be, and they're made out to be not so pleasant, and then they're given a list. And then they go away and they Google it, and they look for it, and they find it, and they read about it, and they study about it. And in a way, I've met people, and they've looked at the different side effects, and they've gone through the list, and they've said, well, I wouldn't want that. I'd rather have that than that. And they've gotten exactly what they wanted. But really, they didn't want any of it. And I've said to them, well, if you could decide that you could pick which side effect you were going to have, did you realize you could have decided to pick none? So sometimes, obviously, going in and going back to those specific events and those specific memories at the time when the person, first heard that news or first experienced that news, not the actual diagnosis, but in relationship to what they may experience in regard to the treatment, and going and tapping on those memories and using the FasterEFT thinking system and simply using the technique, tap it down, tap it up, is wonderful. So I just tap down the belief till I just say, well, how true is that you're going to get side effects? And say, oh, so true. Okay, and tap, 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 tap. Bring that down, bring it down, bring it down, keep bringing it down, and then tap in the opposite, tap it up. The opposite is usually what they do want. Well, I want to feel relaxed. I want to be comfortable. I want to be able to experience this easily and effortlessly and go into the environment and receive the treatment, because it does have a job to do. In a parasympathetic nervous system kind of response, where therefore that's going to help minimize the side effects just in of itself. And then, for example, I've been working on and developed, and I don't know whether I've developed them or picked them up elsewhere or added it into my framework, where obviously there's a part of us that's involved in assimilation of the substances that enter into our system. For example, through food and water and even air that we breathe. So there's also a part of us that's involved in elimination of the dregs, of the residue, the part that perhaps isn't the pure, that's gleamed away from the impure fraction. In traditional Chinese medicine, we might look at the spleen, primarily involved in the digestive process, and it has a function of transformation and transportation. Transformation is the transformation of the food that we take in, where the pure fraction is gleaned away from the impure fraction of the food. And that begins to form the fundamental substances of the human body, being the energy, or the chi, or the Japanese call it the ki, or the Ayurvedic medicine doctors call it the prana, or our life force. All of these words that we use in energy psychology, you know. And the transportation function is that essence needs to be transported through the organism. So if there's a part of us that's involved in transformation and transportation, there's also a part of us that's involved in assimilation, which is similar to transformation, but they are different words. They're spelt differently. So there's a difference there. But there's also a part of us involved in elimination. That could be transportation, because the part that's due to be eliminated needs to be transported through the large intestine and the small bowel after it's left the gut, where further reabsorption and uptake of nutrition is further pulled away from that impure fraction that is then released from the body. So by simply tuning into this part of us that's involved in elimination, and rather than working against the chemotherapy, because I find a lot of people get taught to fight it, and their friends say, you can fight it. And all of these words you and I know, mate, you know, we fight it, we kill it, we destroy it, we irradiate it, we cut it out, we take it out. To me, that paints a picture to me of a battlefield, and it's our body that is the playground. So I encourage the patients that I work with who are having chemotherapy to work with the chemotherapy. It's given for a reason. I'm not a medical doctor. I'm not an oncologist. It's not my area of expertise, knowing their medications and what it is they administer. But behind what it is that they do, they only are doing what they learned. And they want the best outcome for their patient, just as we do. So we want to work together. So I believe that integrative medicine or complementary medicine, there's a huge potential for it to come together with Western medicine sciences, where we're working together. And if we look at this model, then we want the body to work together with that kind of treatment as well. And when we have a belief that we have to fight it, that in itself, the mere language of it, fight, is putting us into that sympathetic nervous system response, which is only keeping us in survival, not repair and rebuild. So I teach my clients some tapping methods where we work with the part, the chemotherapy, we thank it for the job that it has to do, we allow it into the system to do that job, but then we trust that once it's done its job, there's a part of us that's involved in getting rid of that. And that part is feeling really overwhelmed at that point in time. It's got a lot of work to do. It's kind of running overtime. And, you know, it just needs a little bit of acknowledgement. It needs to know that it's not there all by itself. So I've developed my own tapping scripts, so on and so forth. And I don't script them because I don't write them down. But when I'm working with a client, it'll just unfold and unpack. And I then teach that to the individual, and they go away. And I notice that those folks that practice putting this into, they don't get side effects. So obviously that part of us that is involved in clearing out the toxic, because let's get real, chemo, I know that the treatments are toxic. So we want the system to work, but it just needs a little bit of encouragement. It needs to know that it's not doing it all by itself. And there are many other parts of us that might want to come in and lend a hand to that system. Give it some help. Just as we help others in our external world, so too can other parts of us come in and help other parts that might be feeling a little bit burdened and a little bit weighed down with all of the extra tasks that they have on in that time. So some of the side effects can be easily addressed with these tapping protocols. And whether it be FasterEFT or EFT, or doesn't matter what it is, they're all fantastic, because we're just calming down the system and helping the body to do what it does best, which is to try to regain some form of balance.
Excellent answer. Okay. And my third question is, well, when you work with people, with all different types of cancer, is the treatment all the same, or you have to do something differently? Like, I mean, you tap around certain emotions, which may have, which will get us to the other question. Anyways, well, maybe you have some experience in there are some patterns in people's behavior, and what I want to know is actually if the treatment you give the clients differs from one another. Like if you work this way with one patient and the other way with other one, and are there any common patterns in their behavior which reminds you of something you knew before, so it kind of gives sense that this patient has a cancer. You know what I mean? Because
Yeah,
I know
sure.
from the Chinese medicine point of view, you certainly understand emotions a little bit differently than we do, and you know more.
Sure. Sure. Well, to begin with, I very seldomly will treat the person the same way because I'm seeing across the board all kinds of cancers. And I distinguish myself very carefully and position myself very carefully because a lot of the patients that I work with, Thomas, are coming in and all of the focus is around their illness. And there aren't too many people who are focusing on their wellness. So in a way, I've kind of I understand the languaging of Western medicine sciences, although I can get lost in a lot of the technical terms, especially in relationship to the pathology, the etiology. But the etiology, which is often labeled as being the cause, is often unknown. They don't know what caused this problem. So primarily, a patient will come in with a major complaint, and I try to address them with that because that's what they're looking for relief for. I'm not focusing on the illness. I'm not talking to them about their diagnosis or prognosis, which is what Western medicine sciences have said about the course of the illness that they're experiencing. And I really try to help to enlighten them and empower them with focusing on their wellness. And it's not too far away from illness. If we look at illness, ILLNESS, and we just turn the I into an E and put a W in front of it, we have wellness. Pretty close. Not much of a move. So every patient to begin with individually is different. And I think a very powerful understanding of cancer is through metamedicine, Germanic new medicine, and what Richard Fluke is doing with advanced clearing energetics in relationship to trauma, events that we might experience, which is somewhat different from a FasterEFT's point of view, or even a Chinese medicine point of view, where we have an unexpected, dramatic, isolating conflict, emotional shock, where we have no strategy to be able to deal with it. And it hits us in a particular organ, our heart, and is lodged in our gut, is sent up into the brain, and the different relays in the brain will then designate the best part of the body to be able to deal with that. So I'll sometimes look at that toolbox. I think it's very, very useful, and I'm still exploring and learning a lot there and studying with Richard, and it's fascinating work what he's doing. I guess secondly, when I've built rapport with the patients that I'm working with, because these people are coming in and we never know what is in behind it, and what they've been going through and what they've been experiencing, and again, they all come from the place of that there's something wrong with me. I'm broken. Whereas obviously with the FasterEFT belief system, we believe that you're not broken, there's nothing wrong with you. In order for you to have your problem, you have to know how. So there's a structure behind it. But I guess without going too much further into that individually, the common theme that I see running once I've built rapport with these people is that there's been a lot of trauma, a lot of stress. And I'm not just talking big trauma, car accidents and fires and global catastrophes, so on and so forth. I'm talking about everyday stuff, relationship stuff, work stuff, friendship stuff that turns sour, traumatic childhood memories, a lot of anger and hurt that these people are holding inside of themselves. And when I ask them what's been going on in their life the last 10 years, every one of them will tell you their stories. And of course, you and I know that, we've learnt to detach ourselves from the stories, and we understand that they're all made up and they're not real, but these people are convinced that they are. And they're holding on to all of that emotional baggage inside, and that's affecting the flow of the energy through these meridians, which is in turn going to create blockages. And cancer, from a Chinese medicine point of view, is there's a disruption, there's a blockage or a disruption. I don't really kind of like those words very much anymore. I used to use them a lot, but let's say, an impediment or something that's unresolved in the energetic system that's sitting there, that becomes lodged, that then starts to build up as an accumulation of cells because the flow is not happening anymore. So that tends to be the common patterns that I see. And obviously, I don't differentiate between, breast cancer and a large bowel or a large intestine cancer. And that's where I might look at what Richard is doing with advanced clearing energetics, because, there are specific Uden moments, what he calls Uden moments, behind every 6 stages of disease. And I might look into that. It's very interesting because oftentimes it'll show up. And that's giving you specific events and memories to go back to clear that blocked energy out, or to resolve or dissolve that energy that's where the flow has been impeded. Is that kind of what you're looking for? Something like that? Yeah, it's a big field, and as I said, I'm seeing people and they're coming in, and a lot of the time when I'm seeing it, I don't know what they're coming in for, what they want some help with. One interesting thing, Thomas, is I seem to have gotten a good reputation there in relationship to being able to help people who have fears of needles, because obviously these people who have fears of needles, they're going and having conventional treatment, they're having to sit in a hospital environment and have an IV put into them to be able to receive the treatment. And there's a little bit of a difference between being slightly nervous about a needle to having a fear of needles to having a phobia. A fear is like a 10 out of 10 and a phobia is a 20 out of 10. And I've had quite a number of people that have come with this problem. It's so interesting that, mainstream medicine is happy for those folks to be in that environment, for those folks having that treatment, and a total sympathetic nervous system stress response, survival response. Yet they know all about this stuff, the nervous system and how it affects our body. Now, I kind of laugh because I kind of think, well, what better person for a person with a needle phobia to come to than an acupuncturist? And the only reason why that is because right at that time, if I get rid of their needle phobia, I can test it. Because if I can pull out an acupuncture needle and stick it in them, I've done some good work, because we know that us FasterEFTers, we love testing. Test. EFTers, tappers, test. Let's see what work we've done, what's left, what else is to go, what other aspects are coming up, so on and so forth. Let's get all the parts and pieces as to how they construct their strategy inside of them. So I've been getting a number of people coming to me with needle phobias, and in relationship to that, FasterEFT is just wonderful. And it's certainly possible to be able to help that person very quickly, so that you're pulling them out of that survival response, so that they can go and sit up there in the hospital in a relaxed response and have the treatment, which is going to then have an effect on helping the part of us that's involved in taking it in, and then the part of us that's helping to eliminate it, because that doesn't work when you're in survival either. We don't need to be pooping as we're getting away from the target. We need to be getting out of there. So it's all kind of fits in, and I use FasterEFT as my treatment of choice or protocol of choice in relationship to doing that, and it just gets it really fast. And there might always be more work to do, but from a 20 out of 10 down to a 1 for that person in 20 minutes, 30 minutes is amazing, and so helpful just in of itself for that person. Nausea is something that can also be very easily helped. A lot of people experience nausea, so we just ask our question: how do you know? What kind of feeling is it? Where's the feeling? What's the size of the feeling? What color is it? So on and so forth, because nausea is just a generic word that we put to some sensations and feelings that we're experiencing that we might call symptoms. And when we put those symptoms together, we label it. But when I meet people who have nausea and I say, how do you know? The FasterEFT question, which is brilliant. Very good question. You hear all sorts of things, and each individual is different. So no treatment is the same, because treating one patient for nausea might not be the same as the next, because subjectively their words, their languaging is totally different. And people will experience it down here in their gut, just below the ribs where the stomach is. We all think our stomach is kind of down here, but it's actually just lodged in under the rib cage here, just below the xiphoid process, which is where the sternal angle meets, to up in the chest or up in the throat. So when we just start aiming and getting really specific with, the sensations, the feelings, the size, the weight of it, the color of it, the emotions behind it, and we just tap on that and let it go, it comes down really quick. Really, really quick, because, and again, that is so helpful for a patient experiencing that, because unfortunately some of them are experiencing it all day. So they're not getting any nutrition into them, which comes from the replenishment branch of my multifaceted approach. If they're not keeping anything down, they're not making chi and blood and energy, so on and so forth. So you've got to look at the whole configuration. It's really cool.